Are you undecided between herbal antimicrobials and antibiotics for SIBO? The common belief is that antibiotics are quicker and more effective. However, this approach could leave you with an unresolved overgrowth depending on your presentation. The real difference between herbal antimicrobials and antibiotics is based on the situation. Let's review the pros and cons of each so you can make the best decision for you. The decision between herbal antimicrobials and antibiotics should not feel overwhelming. Both can be solid options, but that does not mean that they are equally effective all the time. Today, I want to help you make the decision that is right for you by looking at the pros and cons of both options. But before I do, allow me to introduce myself. I'm Dr. Arland Hill, and for the last 20 years, I've been helping first-time and recurrent SIBO sufferers restore their gut function by targeting all three phases of the condition to resolve symptoms in a timely manner. Without hesitation, let's jump right into today's content and look at the pros and cons of antibiotics and herbal antimicrobials. We'll begin with antibiotics and start with the pros. The first pro of antibiotics is that they work fast. They generally are going to be the shortest route to resolving the overgrowth. Many times that's going to be within 14 days. Several studies have looked at using antibiotics for longer periods of time, even up to 8 weeks, and many land on 4 weeks as the optimal time frame, but 14 days can be effective with antibiotics. And you don't have to settle on just one antibiotic. There's actually several antibiotics that could be considered here. By far the most popular is going to be rifaximin. But rifaximin, depending on the situation, may not be the optimal choice. Metronidazole, clarithromycin, neomycin, and there's several more that could be considered here, or even combinations of these may be the optimal strategy based on your presentation. The other thing that's advantageous about using antibiotics is that they're readily available through pharmacies. So it's not as if you've got to hunt these down and waste time trying to figure out where you're going to get your treatment option at. The local pharmacy is probably going to have you covered on that. And it's going to be the same from all sources. So you'll see why this makes a difference when we talk about herbal antimicrobials. But an antibiotic from one pharmacy is going to be the same antibiotic from the next pharmacy as long as it's the same antibiotic name. So we don't really have to be concerned about quality there. Additionally, there's going to be a lot of research behind antibiotics. By far, when we start talking about overgrowth in SIBO, antibiotics have been studied as the intervention choice for managing the overgrowth at a much higher rate than herbal antimicrobials have. So that's a definite positive. We have a lot of data that we can go and look at and help us make decisions with. Now, typically when we look at the antibiotics, these are going to be, especially with the most common one, which is the one I'll speak to, rifaximin, the effects are going to be localized in the gut. So we're looking at predominantly where the impact of using that antibiotic is going to be at. And while antibiotics can be effective as a standalone, that's a favorable aspect of them too. But understand that while that is possible, that is also falling out of favor. So even though I'm dropping that in the pro category, that may not be a pro in years to come. We may not see that as the same pro that we currently do. And the part of the reason maybe behind that is that the more we use these antibiotics, and we see this really across the board with all prescription antimicrobials, whether we're talking about antibiotics or antifungals, a similar pattern has played out where in the case of, I'll use another example with H. pylori, we've seen H. pylori, a bacteria that resides in the stomach. There has been a continual trend for that bacteria developing antibiotic resistance, even up to the point that commercial labs are routinely running tests to show genes that are resistant for H. pylori now. It's pretty commonplace. You also see this, I mentioned the antifungals. Antifungals have lost their efficacy over time too, where we're starting to see that the fungus are developing resistance as well. So the point behind this with antibiotics for SIBO is that it appears there's a strong possibility that we may be leaning into the same direction. And that's probably a pretty good segue into the cons section of antibiotics, maybe why we would decide against using them. And so one reason would be is that antibiotics are expensive, especially when you do a cost comparison against herbal antimicrobials. And if you're paying out of pocket for this, then they're definitely expensive. Rifaximin is not a cheap antibiotic. Another con here is that they can be ineffective with similar overlapping presentations. So what would a similar or overlapping presentation be? Well, the two most common by far are going to be small intestinal fungal overgrowth or intestinal methanogen overgrowth. And those, when you use an antibiotic, you're certainly not addressing the fungus, and you may be addressing the intestinal methanogen overgrowth, but those aren't bacteria, those are archaea. And so archaea do respond to antibiotics, but they don't respond the same way that bacteria do, which generally means that it's going to lead to additional courses of antibiotics or antifungals to get this under control if there's that co-overgrowth, if you will. And as I mentioned a little bit earlier, antibiotics are at risk for antibiotic resistance. There's just really no way, if you're going to continually use them aggressively, there's just really no way around that. Those bacteria are going to adapt over time. So we need to make sure that we're eradicating when we look at using antibiotics. But here's the conundrum in that. To have an effective outcome with SIBO, eradication is not the goal. What's known as decontamination is the goal. And that's just another way of saying that we need to get the baseline levels of bacteria or the bacterial levels back under baseline. It's acceptable to see some of these bacteria around, but we don't have to completely eradicate them. The use of antibiotics is more in line with eradication, frankly, because you're trying to eliminate everything, and if you don't do that, then you're giving these organisms an opportunity to develop resistance there. Another con here is that you are going to create some damage to the commensal bacteria, and the commensal bacteria are part of what helps maintain stability in the small intestine. So when we eliminate them, it's just simply eliminating an ally here that could help us keep that overgrowth in the small intestine under control. And as you run into with antibiotics in general, there's an increased possibility of C. diff infection. You may also know this as Clostridium difficile. And then you also run into what are just common side effects. If you've ever taken antibiotics, you may have experienced some of these as well. So when we talk about GI signs and symptoms that you could be experiencing, the diarrhea, nausea, vomiting, discomfort in the abdominal area, but you'll also see side effects like skin issues, allergies. These are not atypical presentations. These are known to have a high frequency when it comes to antibiotic use. So those are some of the cons. So if you're thinking in the direction of antibiotics, you're going to have to weigh those pros and cons against each other there. But the real question is, as you're weighing those, what are the best applications for antibiotics? Well, if you're a first-time sufferer of SIBO, if this is the first time that you're trying to get control over your SIBO presentation, you're probably a candidate for antibiotics. If you're dealing with only the overgrowth of bacteria, you know that you don't have fungus or methanogens in there, then antibiotics are the best strategy because you're only focused on the bacteria, and that's what the antibiotics are going to target. If you know you don't have a history of antibiotic resistance, they would be a consideration, but just the opposite is true too, is that if you know you have a history of antibiotic resistance, these aren't going to be the avenue that you should be pursuing. And they are the fastest route to resolution, which is always a positive, but remember, you're always playing that differentiation between eradication and decontamination there. So once you've hit the finish line and gotten that shorter time, use that shorter time frame, you also have to ask yourself, what did I accomplish? So those are all things to think about when it comes to antibiotics. But they're not the only option to consider for addressing SIBO overgrowth. We can also look at herbal antimicrobials. And just like the antibiotics, herbal antimicrobials are going to have their pros and their cons as well. So let's start off with the pros for herbal antimicrobials, and that is that they're effective when combined together. We see that generally when you're looking at herbal antimicrobials are going to by far work best when you're not depending on one single antimicrobial. Combinations of antimicrobials are going to be the best strategy here. And they can work within about 30 days equally effective to what we see with many of the outcomes in the antibiotic studies, so long as they're dosed appropriately. That's the key component here, is that if you want that resolution in 30 days, you have to dose at a high enough dose, and you have to be consistent with that dose over that 30 days. If you're dosing low, the outcomes aren't going to be good, generally as good, when it comes to herbal antimicrobials. Now, the nice thing about that, and thinking about, let me transition back to the multiple options for herbal antimicrobials and using multiple together, is that you have numerous options that you can depend on. There's all kind of different botanicals that can be effective, that are utilized as antimicrobials, and you could choose 20 and still have 20 more to choose from that would probably be equally effective here. So the nice thing is that, and this is interesting, I mentioned a pro for antibiotics is that you have multiple options. Well, a pro for herbal antimicrobials is that you have even more effective options. So there's even more botanicals that can be effective in helping control that overgrowth. And another thing that is advantageous when it comes to these herbal antimicrobials is that you can easily use an empirical trial to see if that's going to be see if antimicrobials are going to be effective. So an empirical trial would just mean you're just trialing you think you have SIBO and you're trialing a combination of herbal antimicrobials to see if your symptoms decrease. If they do, then you know you had SIBO and you've already started the process to overcoming that SIBO presentation. You've gotten the overgrowth under control. You still have to deal with the causes of what set that up in the first place, but using that empirical trial, you were able to get your overgrowth and symptoms under control. Herbal antimicrobials are great in that category. They're also cost effective. They come in at a much lower cost point than do antibiotics, especially when you consider the fact that you're using multiple antimicrobials at the same time. You're not depending on one antimicrobial, you're depending on multiple. It's very easy to find combination products for antimicrobials, and obviously that's not the case when it comes to antibiotics. And they also result in fewer gut symptoms and side effects. You just don't see that as frequently with antimicrobials as you do with antibiotics. The other thing here that I mentioned is that we want to maintain stability in the gut. And to do that, we need the beneficial or commensal bacteria to be able to work for us. Herbal antimicrobials, when used aggressively for a shorter time frame, and I'm saying shorter time frame as about that 30-day or 4-week time frame, if you will, you don't see negative effects against the commensal species in that time frame. And in that same line of thought, many of these herbal antimicrobials also contain compounds that are actually going to stimulate the growth of commensal species. 2 examples to that would be garlic and oil of oregano. There's compounds in both of these botanicals that are going to enhance the growth of your beneficial species. So it's almost, you are getting the best of both worlds. You're eliminating the bad guys, so to say, but you're also building up the beneficial species there. And your use of herbal antimicrobials are also going to be effective against multiple classes of infections and overgrowth. So think back to the not just SIBO, but if you also have SIFO or IMO, the intestinal methanogen overgrowth, remember these can occur concurrently. Using a combination of antimicrobials is going to be effective against all of those as opposed to just one class. And you're not going to have, say, an antibiotic followed by an antifungal. Here, you can just use the combination of antimicrobials effectively and resolve all of those overgrowths. Now, at this point, are you finding this information helpful? Well, if so, help me get this information out to others so that they can make informed decisions just like you're going to be able to do at the end of this video by hitting that like and subscribe button right now. Now, let's move on to the cons for herbal antimicrobials. And the first con here is that there's a small body of research to validate the use of herbal antimicrobials. If we're going strictly on peer-reviewed evidence, which we're not, but we do need it, and we do need to make decisions based on it. We need it as a base, but we can't be. It's not the only thing we should look at. That base of information for herbal antimicrobials, there's some data there, and the data is positive, which is the reason we can move forward, but it's nowhere near as robust as what we find with antibiotics. But we do know that there is good and consistent anecdotal response to herbal antimicrobial intervention, even if we didn't have the data that does exist in the peer-reviewed literature. So that is one con. The other con is that you need multiple antimicrobials. So in some cases with antibiotics, a single antibiotic is going to get you there. That's not the case by and large when it comes to herbal antimicrobials. You need multiple botanicals implemented together to really be effective here. And just like I talked about going to the pharmacy with the antibiotic and knowing what you're getting from pharmacy to pharmacy, it's going to be the same across the board. Well, that's not the case when it comes to herbal antimicrobials. There's going to be inconsistent product quality out there, so you really need to be mindful about where you're sourcing your products from and making sure that what's in the bottle is actually in the bottle. So that's very important because it's not really going to do you any good at the end of the day if you're not taking an antimicrobial that doesn't have the punch that you need to really get that overgrowth under control. And it is going to take, in terms of dosing, more frequent dosing compared to antibiotics. So that's a downside too. But you're doing it for 30 days. So if you're feeling compelled to go, or if you feel more led to go with the herbal antimicrobial use, which I'll admit that is what I prescribe to patients, then the difference between 14 and 30 days is really insignificant. And most of the time, the antibiotics are going out to longer time frames as well. So 30 days is truly, 1 month is not that difficult to achieve. It's not that big of a burden. Now, the best applications for herbal antimicrobials, well, if you know you have the presence of antibiotic resistance, you definitely should be looking at herbal antimicrobials. Also, when you know that you have multiple overgrowths, it's not just SIBO, but you have SIFO or IMO at the same time, that's absolutely when you should be thinking about herbal antimicrobials as your option. Or if you just want to do an empirical trial, that's also the time to do herbal antimicrobials, even though that strategy is very commonly recommended with antibiotics. Now, it's really interesting because I had a question that was presented to me at a conference I attended not long ago from another practitioner who asked me, will these herbal antimicrobials resolve SIBO? Well, neither antibiotics or any combination of herbal antimicrobials is going to fully resolve SIBO because dealing with the overgrowth with antimicrobials or antibiotics, guys, that's only step one. You still got more work to do. You need to focus on the other steps once you finish up with the herbal antimicrobials or the antibiotics. So are you certain about what you need to do beyond step one of an antimicrobial or antibiotic protocol for SIBO? Well, if you're not, No problem. There are two other phases in dealing with SIBO that you absolutely need to be aware of so you can prevent relapses. Take a look at the video on the screen now to learn about those.